Thank you very much, Mr. Speaker. Uh, Thank you very much, Honorable Member, Dr. Cummins. Uh, the member, Mr. Speaker, asked, where is the comprehensive plan? And the comprehensive plan is with the stakeholders who are implementing the plan. And as you know, the plan has various sections, including the provision of personal protection equipment for the frontline health workers. And we have been sourcing these types of things like masks, uh, goggles, face shields, gongs, uh, the hair cover, foot cover, and all that is necessary for these frontline health workers to protect themselves while delivering care. And that situation has increased dramatically from what we have inherited. The second component of the plan, Mr. Speaker, talks about increase in testing. And with increased testing, as you would know, when we came into office, we were only doing about 21 tests per day. And while we were doing 21 tests per day, our range of tests were very limited. And so as of now, at the National Public Health Reference Lab, we are able to do about 1,500 to 2,000 PCR tests per day. That has increased our capacity tremendously. And on an average day, we're doing close to 450 tests, PCR tests. In addition to that, Mr. Speaker, the private sector has come on board, and Eureka Medical Laboratories have also been doing PCR testing. And there are a number of other institutions that are pending accreditation from the Ministry of Health. Apart from PCR testing, we are also using the GeneXpert machine to provide point-of-care testing in several regions. As of yesterday, we have now placed the GeneXpert machine in Letem so that we can do point-of-care testing there. And one such machine is also in Region 1, and during this week, we'll send a team out to train those persons in Region 1 so that we can start utilizing that GeneXpert machine there. There's also an additional GeneXpert machine that is in Region 6 and one that is in Region 10, and we are procuring about 2 others that we'll place in some of the other regions. In addition to PCR testing, which is both the GeneXpert and those that we do at the National Public Health Reference Lab, we are also doing antigen testing. And apart from the National Public Health Reference Lab being able to do those tests, we have now been able to accredit a number of institutions, including all the regional hospitals and a number of point-of-care areas, health centers and so forth, where antigen tests can be done in the public sector. In addition to that, we have already accredited 5 private sector entities to be able to provide antigen testing, and we are in the process of accrediting another 5 this week. By this weekend, those names of those other entities would be published. In addition to improving testing, Mr. Speaker, another component of the plan talks about contact tracing. And with contact tracing, we have our central team at the surveillance department who is responsible for contact tracing. And in every region of Guyana, the regional task force comprising of the RHO and his team are required to do contact tracing. So we have a comprehensive network of persons who are doing contact tracing. And I must say to the honorable member that every morning at 7:30 in the morning, each RHO reports on the things that happen within their region pertaining to COVID, how many new cases they have, what steps they are going to take in terms of the cases that they have, and the plans that they have to do contact tracing or additional testing. And this is happening every single morning, whether it's a holiday, whether it's on the weekend, whether it's Sunday, the RHOs and that team is reporting every single day. In addition to this, Mr. Speaker, another component of the plan speaks to isolation and quarantine facility. And every region has at its disposal public buildings that have been repurposed and retrofitted as isolation centers, and the same for quarantine facilities. So we have adequate space in our institutional quarantine areas and, of course, the isolation areas. Additionally, another component of the plan deals with clinical management of patients. And here we have sought to increase the bed space and bed capacity for persons with COVID. And so at every regional hospital now, the doctors have been trained to be able to manage COVID cases. And so if you have mild symptoms and you're in the isolation facility, you would be managed by one of our doctors who have been trained to do so. And if you have more severe symptoms that require hospitalization at any one of our facilities at the regional level, you would be able to get that type of care. In addition, we have the Ocean View facility, where we have 150 beds that are right now being utilized. And of those beds, we have 25 ICU beds. So persons needing ICU care can get that care at the Ocean View facilities. And with complicated cases, if the regions cannot manage them, we send them down to this specialized facility where we can offer care for the more complicated patients. In addition, Mr. Speaker, you would realize from the press that the government of Qatar has kindly donated to Guyana a field hospital. And that field hospital has 60 beds, of which 20 can be used as ICU beds. We are currently in the process of determining which one of the areas we are going to set up that facility. Initially, as the honorable member said, we wanted to set that up in Region 3, and we have made such an analysis of what we can do there. And then we thought that maybe we can consolidate it at Ocean View. So there are still some decisions to be made, but at this point in time, we have enough bed capacity for both persons who require normal hospitalization or ICU hospitalization. We have enough capacity currently. And very shortly, we'll determine exactly where we're placing that field hospital. And once we do that, we'll set up that hospital. In addition to these aspects relating to health, Mr. Speaker, we have also developed a number of workplace strategies, and that is another component of our plan as we work with different workplaces in ensuring that they have the measures relating to COVID so that they can continue working in those facilities. And of course, another component of the plan deals with our economic relief. And the government of Guyana has been working with small businesses to provide COVID economic relief to businesses who have been affected by the disease. And we have also, as you would know, rolled out a plan where each household benefited from $25,000 as COVID relief. And we have some measures. When we lock down specific areas, we were able to provide hampers through the CDC and other organizations. So economic relief has also been part of our plan. And of course, Mr. Speaker, another component of this plan deals with public education. And while we have an aggressive program on television and social media, we have also been working very closely with the joint services through Operation COVID Curb to ensure that our citizenry are well aware of the dangers of COVID and the measures that they can take to protect themselves. And then the most recent component, Mr. Speaker, that we have added to our plan is to ensure that we acquire vaccines to prevent the disease. And we have worked out a system of how we are going to allocate these vaccines and roll out this program. So, to the honorable member, yes, we have this very comprehensive plan, and I just give you a broad approach to what we are doing. And also, yes, we can make a copy of this plan available to you. Right now, we are updating the most recent component dealing with vaccination, and as soon as we finish that component, we can make that plan available to you. Mr. Speaker, I have a little challenge here. Because, as you would know, with the new government, the entity known as the Ministry of Public Health ceased to exist. So if we are talking about that entity, then I would say that I am not sure whether they had the capacity to be able to do gene sequencing, and more so because after our first case in March, on the 11th of March, one of the variants that were circulating then, which became a dominant variant around the globe, was the D614G. And I haven't seen any reports by any person in the ministry that points to them understanding that this was a mutant variant that was circulating. So I would say at that point in time with the Ministry of Public Health that they did not have the capacity to do so. I'm not sure what's the nexus between the variant strains and the vaccines. But nevertheless, I would endeavor to answer the honorable member. And that is, indeed, we have been looking at the various strains that they have. The one that is next door, the P1, we have been looking at that particular strain and what is happening in Manaus and the state of Roraima. And that is one of the reasons why we have closed the border between Guyana and Brazil, and we have also stopped all flights from Guyana to Brazil and vice versa. So we are monitoring the different strains. Right now in the world, Mr. Speaker, the B117 strain was first found in the UK. It is now in 80 different countries. And the other strain, which is the B1135, the South African strain, as it's commonly known, or was first determined in South Africa, that is right now in 40 different countries. And the P1, which was originally discovered in Japan from travelers emanating from Brazil, that one is right now in 10 different countries. So we are monitoring the different strains and what is happening. We participate on a weekly basis with the WHO as they tell us more about these strains and what is happening with them. We are part of a network of 22 laboratories in South America and in the Caribbean that has been monitoring and doing gene sequencing so that we can know about the circulation of the different strains. So this is happening. And as you would know, Mr. Speaker, we have a partnership now with CARPHA where we are sending every month at least 10 samples to CARPHA so that they can do gene sequencing. We have sent the first 10 samples and we are awaiting the results. And right now we are working on a partnership with PAHO to be able to send through PAHO to the CDC in the United States so that we can add to the range of sequencing that we can do. And so these are how we are tracking the different variants. In addition to that, Mr. Speaker, the honorable member asked about vaccines. And yes, we have been working through the COVAX facility, COVAX AMC, to be able to get vaccines for Guyana. And COVAX has allotted to Guyana for 20% of our population. The first installment of those vaccines, we are expecting that we are going to get 104,000 doses. And so we would have adequate vaccines to be able to immunize our frontline workers. Those vaccines, they are going to be the AstraZeneca vaccine, and that is being manufactured by the Serum Institute of India. But what is pending is the WHO authorization, because it's not listed by WHO as yet, and the WHO expects that by the mid of this month, that they will be able to grant emergency use authorization for the AstraZeneca vaccine. This vaccine is already in use in the UK, where it has been granted emergency use authorization. It has been in use in the EU, where again they have granted it emergency use authorization, and it has been granted emergency use authorization in India, the place where it's being manufactured. So we are going to get those vaccines. And in addition to that, the government of China has donated to us 20,000 doses of vaccines from Sinopharm. And Sinopharm is one of the biggest manufacturers of vaccine globally. And so we are going to get those vaccines shortly. In addition to the COVAX arrangement that I spoke about earlier, we are in a number of bilateral talks with various countries, including not only China, but Russia, India, to ensure that we can have more than that 20% for this year. And we are also talking to a number of multilateral agencies through which we think we would be able to acquire vaccine. One such multilateral agency is CARICOM has brokered an arrangement with the African Union, and they have set aside 1.5 million doses of vaccines for the Caribbean. And out of that allotment, Guyana's quota is going to be 149,000 doses. And so we are working with that platform to ensure that we will also get doses from that mechanism. In addition to that, we have been engaging the manufacturers themselves, including those who are manufacturing the mRNA vaccines and some of the other types of vaccines that we think in the short term would get emergency use listing. Pertaining to lockdown, that's always an option. But as you know, that in our management of COVID here in Guyana, we have exercised that right to do partial lockdowns, and we have done that in many communities. So that's an option. In addition to that, we have also, as you rightly said, some countries have restricted flights, and we have used that tool as well, because our flights going out to Brazil, or flights emanating from Brazil, we have now stopped all of those flights. So these are tools that countries would use, and we would, as we deem it fit, and based on the epidemiological situation that we are monitoring, we would also employ those tools as we see fit. Indeed, at this point in time, we do have adequate capacity for testing, contact tracing, treatment. We have all these things in place. I outlined earlier some of the steps that we have taken, and you can rest assured that in every region that we have put testing in place. We have expanded the hospital capabilities, and of course, we have contact tracing in those regions. So we have the capability right now, and we are expanding those as well. So you would have seen recently we have made some move in terms of expanding the infrastructure that we have, just in case. And we hope we don't have to use it, because we are moving to the next phase now. where we strongly believe by the utilization of vaccines that with the right amount of persons taking these vaccines, and once we get high uptake, that we will be able to develop herd immunity in Guyana, which would allow us to exit the pandemic here.